Coonrod, and this presentation is about Albuquerque down and out calls with the homeless population and Albuquerque Police and Fire and Rescue Departments. There are at least 200 more homeless people living in Albuquerque than there were 2 years ago. This only counts the people that are easily spotted and fit a specific definition of homelessness. This definition includes sleeping in shelters, in transitional housing, or in outside places. This excludes people who are harder to find or people who are crashing on a friend's sofa. The Albuquerque Police Department and Albuquerque Fire and Rescue has to respond to more down and out calls due to the increasing homeless population. It is considered a down and out call when the person being called for is down on the ground and out of consciousness, therefore down and out. The point-in-time count for homeless population last year was 2,551. That depends on the certain count you're using for the homeless population. So this count ranges from 2,000 to 4,000 people. The total number of homeless students was approximately 10,000 people. Last year, nearly 18,000 people were called to report down and out individuals around the city. These calls were to 242 cops or to 911. The Albuquerque Fire Department responded to 16,598 of those calls, while the Albuquerque Police Department responded to 1,374 of those calls. Approximately 7,000 of those calls went to the ER, while only 100 of them had a life-threatening condition. This cost $2 million in first responders' expenses, and it cost $14 million in hospital charges. 10,000 of those calls were ghost calls, meaning that nobody was there when first responders arrived. This cost nearly $1 million in wasted time. Many of the people called in for down and out calls are taken to the hospital even if they don't have a life-threatening condition. They take this as an opportunity for access to a warm bed and to good food. Some also use this as a chance to sober up. Patients who are homeless experience a high 30-day readmission rate due to the lack of resources available to those with conditions that need taken care of. Due to the lack of resources, individuals who are homeless frequent emergency departments for immediate health care needs. Many of them can't pay, and there aren't measures in place for rescue to deny treatments. Individuals who are readmitted cost hospitals financially and affect their reputability as readmissions are used as a direct indicator of the quality of the hospital. Most readmissions occur early after discharge. The process for responding to a down and out call. First, emergency services are called for an unconscious person in a public place. Second, dispatch categorizes the call as a priority 1 and Albuquerque Fire and Rescue is sent. Third, if a weapon is present, officers from the police department are dispatched. Fourth, rescue first needs consent from the person before transporting them to any hospital. Fifth, many people take the opportunity of transport to gain access to the resources located at hospitals. And sixth, in some cases, the person isn't even present when rescue arrives. My proposal is in 2 parts. First, to create a team that combines the Albuquerque Police Department and Albuquerque Fire and Rescue that is specifically dedicated to down and out calls. And second, have this team work in conjunction with existing shelters to help with rising hospital admission rates. Any additional costs with this proposal because existing resources will be utilized instead of creating new programs. The officers that will be a part of the team will be already trained Albuquerque Fire and Rescue and Albuquerque Police Department officers. They will focus their existing hours on down and out calls when necessary. This will be instead of hiring and training new officers to be a part of the Albuquerque Fire and Rescue team and Albuquerque Police Department team and focusing their time on down and out calls. That would just waste Albuquerque taxpayer money. There are also many shelters in place for the homeless population that are not utilized like the hospitals are. So if the person being called for the down and out does not need emergency medical attention, they can just be taken to the existing shelter for a warm bed and for food. The benefits of this proposal will create a team to focus on down-and-out calls, will alleviate the slow response time from other Priority 1 calls. Since now, many of the officers that are sent to down-and-out calls are putting other calls on the back burner to take care of the down-and-out calls, when some aren't even there upon arrival. Instead of transporting to the hospitals for non-injured, transporting to existing shelters would prevent the millions of dollars spent in hospital charges. And also, by providing transportation and information about shelters, it will decrease the numbers of people sleeping on the streets. Overall, this proposal will be beneficial to the Albuquerque metropolitan area. Thank you.